Hi, welcome. My name is Sophia Renville, the Director of Scholarship Program at the National Alliance for the Advancement of Haitian Professionals, NHAP. Is a nonprofit organization committed to provide educational and professional opportunities to Haitian professionals. Every day we strive to make an impact by empowering the Haitian community through scholarships, mentorship, networking, and other career opportunities. Would you like to help us in this cause? All you need to do is to create an account on Amazon Smile and select the National Alliance for the Advancement of Haitian Professionals as your charity, and Amazon will automatically send us a small donation for every purchase you make at no cost to you. Creating an account on Amazon Smile is super simple. Just go to smile.amazon.com. Tap on the Get Started button, then click on the Create Your Amazon account at the bottom. Enter your name, email address, select a password, and tap on Create Your Amazon account. So solve the puzzle and then verify your account by using one-time password you will receive in your inbox. After that, add your phone number for safety, and boom, you have successfully created your account. Now, the most important step is to type in the search bar, National Alliance for the Advancement of Haitian Professionals. Then select NHAP as your charity. Tap on the box that says, Yes, I understand, and then click on Start Shopping. That's it. You successfully added NHAP to your charity. Just make sure to always start shopping at smiles.amazon.com. Thank you for your support. Let's create a better future together.
Bonsoir tout le monde. Good afternoon. My name is Dr. Clédiciane Dorville. I'm a licensed psychologist in New Jersey, New York, and Pennsylvania. And we have today with you Mr. Coles. He's here as our panelist to discuss the shifting trends in suicide for Black adolescents. Um, so between 1991 and 2017, there's been a significant increase in suicide attempt among Black adolescents. It's been such a concern that the Congressional Black Caucus established an emergency task force on Black youth suicide and mental health. So, what they found is that there's a growing crisis in the mental health and well being of our Black youth. The suicide death rate among Black youth is increasing faster than for any other racial and ethnic group. Um, Also, self reported suicide attempts have increased by 73% for Black males and females. Although self reported suicidal thoughts have decreased, but suicide have increased. So they're going directly to attempts as opposed to just having suicidal thoughts. So today we're here to meet with you to have a discussion on this topic. So in terms of our format, we want to talk about risk factors, potential warning signs, barriers, and also how to assist if you are dealing with a suicidal youth. Um, so I'll let Mr. Coles introduce himself and talk a little bit more about himself before we start talking about the topic.
It's okay again to stay calls. I've been
Mhm.
uh, here in the US since I was 22. Now I'm old. I'm 54. Working as a nurse for the past 25 years. I'm a psychiatric nurse with a master's degree. I'm now a professor at one of the at the MGH, one of the major institute in America, practicing psychiatric nursing. Uh, and I'm also a director for McLean Hospital, which is one of the major, the best hospitals, psychiatric hospitals in the nation for the past 20 years. We nous fait un peu de progrès comme Haïtiens. Nous travaillons dur pour nous euh, avancer tête nous, mais il fait nous mal en pile pour nous voir que la communauté n'a pas marché ensemble avec nous. it is hard to know that it is still a difficulty to make the to have the to see the community not pairing with us, not understanding this as a crisis, not seeing this as a crisis, not not taking this seriously and not taking care of this as it should. So, anything I can do today, any awareness we can, anything we can do to make that a full awareness, a full blown awareness into the community, I am 100% into it. I'm willing to support, willing to do anything I can do as Haitian, 100% Haitian, to support, to give it all, to do anything I can do to partner myself with the community to help our Haitian adolescent, which I consider the future of our nation, as my
Mm-hmm.
time is gonna go away pretty soon. So soon's gonna be those our future. Our future will be our adolescents. So we need to protect them. We need to guide them. We need to help them so they can be there, representing us and be there for us and take the baton to help our culture moving forward.
You said something I think it's interesting that the people are not partnering with 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 your organization and in terms of the community. So part of that is it from lack of understanding and knowledge, or just not willing to engage?
I am not sure. One of our best friend, when I sent that invite to him, jokingly, he said it was a joke when he saw how angry I was, but he said Haitians are not crazy, Haitians are lazy. That was his answer to the letter I sent to him, and I was furious when he said that because he's I was probably angry because I see it live when these kids are suffering, when they are cutting themselves, when they are banging their head, when they are hurting themselves, when they are destroying $500,000 worth of materials in their schools, when they are hurting, destroying, or they are taking court cases that's worth that is impacting their lives in the future. So I am dealing with it on a lively basis, on a daily basis. So I feel hurt. I feel the pain. I feel I know what the pain is like because I also dealt with it with my own baby nephew. So I know what it's like. I know what the disease is. I deal with it, like I said, for the past 25 years. So I just wanted to reach out to my best friend and said, "What are you talking about?" Because it's real. But I know majority of Haitian truly think that it's a joke, truly think that it's a silly thing, but it's really not a disease.
Um, I think not just Haitians, but in terms of the Black community in general, there's a tendency to ça c'est problème l'autre monde, li pas problème pa nou. Parce que because there's a notion, um, even within this topic, that Black youth don't commit suicide, which is one of the reasons that I wanted to talk about this, because I see this clinically as well. It's a major concerns in the adolescents. As you said, they are our future, and most of the youth that I had coming to see me is because of these issues, and it's suicidal related, you
Right.
know.
Eh,
So yeah, so I think from the awareness piece, it's very important. Parce que yeah, communauté nou a fait un peu l'expérience avec ça, nous capable parler sur ça, mais ça pas veut dire Li pa la, li pa existe.
Right. The black community, I think the tendencies they have is like it's a weakness if you have mental illness. You are not you are not a man. You're not tough enough if you're talking about mental illness. So when you do have those teenagers or coming to your office or coming to the hospital seeking for help, they're looking behind them to see his dad is there, his uncle, is my uncle is there, what my brothers, what my older brother is gonna think about me. Am I am I man enough? Why am I doing there? Uh, that they see it as a weakness in our black community culture, uh, which is so sad. And sometimes, and that's what put them to shame to, and therefore to suicide because they feel that how am I gonna deal with that, um, knowing that I will have to deal with this for a while, and other people are thinking that I am not uh, strong, I'm not brave, I'm not tough, I'm not that man of the family, and therefore might as well give it up. So I just want them to know it's not a shame to have you would not be ashamed to have diabetes. You would not be ashamed to have cholesterol. Why would you be ashamed to have mental illness? So a disease, whatever it might be. If you have it, you take care of it. I think that's the pride to take it to have. It's to take care of that illness. I think it should be you should be proudful of take care of that illness. I think that's a smart thing to do by taking care of that illness and instead of not because who cares of people who might think otherwise? Take good care of yourself, take care of that illness, be strong by doing so, because that's what would make you truly the hero.
Yeah, and some of the stuff that you mentioned, there are barriers too in terms of reaching out for treatment, not having the support, or when you were talking about we don't talk about it, but those things we've kind of been conditioned in a way. From the days of the field, ou fin fè ti moun nan ou leve, yo met la vou al travay. So you just keep on moving. Men,
Correct,
problem nan ki gen avè sa, yo adrese problem yo toujou la.
correct, correct. And
Um,
we
Go ahead.
go ahead. And we condition ourselves by creating by making ourselves working so much to provide for these kids and at time we don't even see that kid falling apart in our hands,
Hmm.
which we need to pay attention to, um, because it's really not, um, there's more to just providing to this kid, there's more to having that kid to have everything they have, because at the end of the day, you to create that holiness, you need more than just $1 billion house, $1 billion car, $1 billion fancy food, and so forth. You do have to have a healthy individual in front of you.
Hmm. Addressing the emotional needs. If you're looking at Maslow hierarchy of needs, yes, the
Yes,
basic needs are taken care of, but oftentimes we ignore the emotional needs. What's going on internally with the child, or the adolescent? What's going on with them? Because it's a major shift as
right.
you go from childhood to adolescence. So, are you sitting? Are you talking to them? Do you know who their friends are? Or are you engaged in their lives?
Extremely important. And I've seen um, family letting those important key things go. They create these kids. They let the kids run the show, to use that term. But this is once the kid is with you underage, you you owe to that kid to have certain understanding and certain know of what's going on, what the kid is bringing home in terms of friends, in terms of drinks, in terms of food, in terms of uh, what is the you are the parent. Stop being the kid buddy, but be the kid's parent.
Mhm.
Many people are worried about Johnny being my friend. Babe, is he gonna talk to me? But really, Johnny need a father, Johnny need a mother, Johnny need a parent. So be the parent of that kid. Find out what's going on. Find out what Johnny is doing. Because sometimes when you do not do your role as a parent, sometimes it's too late by the time you know it.
Yes, I think an additional factors for Haitian family, because you're coming in as an immigrant, so there's the immigrant process, I guess you could say there too. Ou pa pale anglais, se ti
Okay,
moun nan ki gen pou tradu pou ou. So you sometimes you fall into by
correct.
default the child become the parent in a way.
Right.
And so um, but even if that's the case, there's still some level of parentage that you have to maintain because um, that's when you walk that tight road of okay of giving them because you cannot do certain things, then you put the child in that role. But that in itself is a risk factor too because then you subvert the roles in a way you could say, you know.
Correct.
Um, so when we're talking about like for risk factors, like the task force, they did they looked into this crisis, I guess you could say, going on with black youth and mental health. So for it does not. I guess it's a lot of things too with regard to mental health. There does not a lot of research done on this in terms of risk and protective factors for Black youth. But some of the stuff that we do know, and it applies to Haitians as well, is so if kids and adolescents they have issues, mental health issues like depression, anxiety, um, and trauma more specifically, those are risk factors that do affect that put them at risk for suicide. Poor family support, that's
Co-
another one. Exposure to violence, um, those are risk factors as well. I don't know for you, what do you see with the kids coming into the hospital?
Me, I always do I do always what I call it a trinity work with most of my client. I tell them because I know you kwena mama Mama Marie Joseph, comment il est ça, the Trinity work. So I use that
Mm-hmm.
as a basis, le Père, le Fils, et le Saint-Esprit. So I said that's the same as getting yourself some treatment. You need three ways to get yourself better. You see, you need therapy, you need medication, and you need some type of you need that family engagement. So where you get yourself surrounded by good family, good friends, good people, and good enjoyment in your life. So that's how I always do it. So that way they don't feel like it's a burden. They don't feel like but rather it's part of what would make them feel better. And the work that we do um, at work, it's a no-brainer. You're not gonna leave the hospital unless we get to you connected that way. So usually it's automatic unless you definitely said, I don't want it, I don't want it. So we just work so patiently with you before your discharge. So before you know it, you get all these things, and we beg you very hardly to consider working on those 3 points. May say definitely it is definitely a three-way point where to solidify your treatment, you really need to work on those 3 points. And I've seen so many success with them, so it's no brainer. It's always a 90 to 100% guarantee that you will have a successful future if you stay in therapy, if you stay in treatment with your medication, and then if you're surrounding yourself with positive vibe, positive family, positive friends, and well connected with the resources in the community. So nowadays, as you can see, with the immigrant, a lot of trauma in the road of coming to America. In Haiti, a lot of trauma in the road. I can't even imagine being Haitian right now that you are not living the trauma on a daily basis. Um, Emotionally seeing it, hearing it, and dealing with it. Um, and here, being here, um, the racism, the it's not different, it's not changing. It may get a little bit better here and there, but it's still a factor. So the trauma exists. The being who you are make a huge difference every time you wake up in the morning until you close your eyes. So definitely, all these can constitute more difficulty for you to uh,
Yeah,
extend yourself and get better every day. But I do I do always want my folks, my client to stay in treatment, because that's how you can face those trauma. That's how you can face life and be stronger every day.
because, like, with the research, it shows that Black adolescents report a history of trauma and adversity. They were 5 times more likely to attempt suicide than
Yep.
the ones without a history of trauma. So it's significant in terms of the population that we service, the experience of trauma.
Yes. And trauma is
Mhm.
I don't know. It's gonna take a while when we, as a black community, would probably stop dealing with that. But I think even myself, when I work with my client, I said, listen, even us as clinicians, we go to therapy ourselves for ourselves to stay sane. So it's not trauma. We should never consider being in therapy as something punitive. We have to see it as something positive, as something helpful, as something good, because it's healthy. It keeps you going. It keeps you strong. It keeps you moving. So enjoy it. Not don't see it as a pain. See it as a
I know.
definitely as a positive thing.
Yeah, so having somebody different outside of your circle to be able to process and discuss things with, because not even, like, if we're talking about trauma from the point of a refugee perspective, but like you were saying too, just in the daily grind of life,
Yes,
it can be traumatic in the microaggression you experience every single day, uh, on a daily basis, TV, everywhere. It's
everywhere.
kind of embedded in the psyche of this of where we live.
Yes,
Um, so these things too, they do take a toll, like you were saying.
right.
Um, and even though there's no it's noted as a risk factor, but the increase, um, it doesn't say why the big shift,
Right.
but we do know these factors, they do play a role, you
Correct.
know. So it's interesting that it's within the last 25 years that that major shift has been happening. Is it because they haven't been studying it and looking at it,
Right.
or are there things that are different that are changing? Because even though the numbers are not parceled out by ethnic group, but I do know clinically there's major shift in the Haitian community as well in terms of the people that I see, people I saw in the hospital when I work in the hospital, the schools. You know, these things were there still.
Right. Right. And again, there are things that no matter what, how no matter how much we study and how much uh, we accomplish, we're never gonna change them. So I think it is also time for us as a community to start learning to engage our kids or in those conversations. It's almost like back in the days when people would say, "Let's not talk about sex in the house," and it goes the same for suicide or mental health. People don't want to talk about it in the house because it doesn't exist in the house. Yes, it does. So when you start saying those warning signs, let's talk about it. When you see those drinking habit or those drug use in the house that prevent that kid from going to school more often, or the grades are that are going from A's to F and D's. Let's talk about it. And it's not, don't don't go to the point where why are you being so stupid right now, because you know the kid was doing well, he was doing his grade was doing great, and all of a sudden it's changing. So there is no miracle. It's your baby is the same, the kid is the same. So something has happened, and how can you support that kid to shift him back to normal, to get him back in track?
Yeah,
And sometimes it's a cry for help, and
yeah,
they don't know how to do it, and they doing all these with sob, those pants under the bottom, to just looking, getting your attention, to support them, to help them. Just reach out, just heal them out, just be there for them, and just get them the help that they need.
but do you think too? I think, and what you said too is important. Us focusing on those warning signs for the parents, because I don't know. Sometimes the parents may not know. Yeah, sometimes even the people who are in our fields, they may not realize what's going on. Especially like, let's say now with the kids who are going away to college. Like if you're a parent, you're concerned about your child, or you're not sure, or like um stuff to be able to notice, stuff to stop and pay attention to as they make those shifts, like you were saying, changes in their moods. If you see drastic changes, the child's not the same, they're withdrawn, they're locked in the room all the time, they're acting reckless, or like you were saying too, the change in the grades, and but starting to pay attention to possible cutting behaviors, the use of alcohol or other um, drugs. Um, so these things are things to stop and pay attention to.
Yes, and I think that it's always good to start blaming that ma tante Marie c'est ma tante Marie qui a fait ça, c'est voisine Jocelyne qui a fait ça. I know we believe in all these things, and I respect those beliefs, but
Yeah,
but see the individual in front of you. See that person in front of you. Talk to that person in front of you, and reach out. Moi, mon problème avec moi, I don't believe in just one thing. I like I'm nosy. I like to get more research. I like to hear different opinions. So if matter Joe tell you c'est voodoo qui a fait un problème, mandez mon nom Patrick, mandez seule église Mariette, mandez moun ask question, get yourself informed, get yourself educated on what may cause the that for your baby to be going down like this, because again, you want to save your baby, you want to change your baby in front of you, and getting back to the baby you know before. So you have to don't I think we have a lot of in my community, we have a lot of deaths that happened in the past because people don't talk about them. They keep that secret. They keep that to themselves, and then the little we know, we heard in the news that the kid has had a psychotic break and killed the parents, and then 5 days later, we heard them. The kid had chopped the parent by pieces, and we found the bodies in the closet or in the basement and so forth, or in the back of the car. We you got to find you got to speak out, talk to other people. When you see those changes going towards the negative way, going towards uh, a route that is not okay, that seems not okay, that smells not okay, that doesn't look good to you. You don't need to have a PhD degree. You don't need to have a doctorate degree to know that uh, Tinono is not doing good. Tinono is not the same Tinono you knew that was excelling in school, that was doing great in school, that was doing fine in school. You know Tinono best than anybody else. Ou se maman Tinono, kon Tinono, ou fait Tinono. Lo, ou konen Tinono is not or doing okay. Ou ouais Tinono, et c'est pas même Tinono ou te fait. So, the minute que Tinono is not acting the way Tinono used to be, find help, asking question, talk to anybody like myself at the hospital. My housekeepers, Haitian housekeepers, are my best friends. My kitchen workers are my best friend. I speak with anybody. Anybody's welcome to my office. Anybody's welcome to talk to me anytime, anywhere. Stop me, talk to me, ask me questions. Come to my office. You have the question you ask me. Nobody is has difficulty reaching out to me because I know if I know something, I know it for the community. If I know something, I know it for everybody else. And you need to me, and I'm open for you. So the question is, you got to reach out to someone who knows, or someone who may know what's going on, so you can help those kids. Those kids need us. They need our support. They need our help, and we cannot hide them at home. We cannot keep them in secret. We cannot. The more we keep them at home, the more we keep them hidden, the likelihood, the chance that they're gonna hurt us, they're gonna hurt themselves, and then it's not gonna be good. So please reach out. Parler power la lowe ti moun na pa normal. Parler avec un l'autre moun. Parler avec un moun ko quel que soit moun nan ki ka you know that can help. Please let someone know we can get help for the kids, please.
So, from what I'm hearing, and also it's interesting too. So, a major barrier for the Haitian community then is the secrecy. So, mpa bezon lot moun konen, mpa vle moun konen sa ka pase la kay mwen.
Right. Right, we can do that. We can do that. And thank you, Dr. Darville, for inviting me for this. That when I think I told you that off the camera, when you invited me for this symposium, that's when I realized, oh my God, that was the best thing that you have done for me, because I've realized that, oh, that is a start of something different, so start of something new. And from that point forward, I have started to give, and I will continue to give talks everywhere, because the awareness is important. We now I'm going to we now our next talk is gonna be on domestic violence for Haitian community, or for Black community in Lynn. We're going to do a lot of talks moving forward, but it is important that people know among ourselves, or not talking is never gonna work. Not talking is probably gonna create more harm, create more pain to the community, to the kids, to the family. We got to speak out. Kembe Powell Lalakai, Feti Secret, none of them is gonna work. We got to talk. We got to speak out, parce que si nous pas faire ça, someone's gonna get hurt. And I think one of the major things, because I had one of my client, when we said the kid was acting out because the voices were so loud, he was destroying things in the house, and I said to him, you need to call the police and get the kid to the hospital. That was a major trauma for the family, because they see police, jail. They're like, no, I cannot call the police, because they don't understand police get to the hospital, get to the ED mean uh, support in hospital. They could not relate that. So
Yeah,
not all
everything
call to the
is
police lead to the jail. So at time, you got to call the police to get the patient to an ER, and from the ER to get the police to us, to the hospital. So police is not all called to 911, get the kid to the jail. And now the 911, the police are being educated. A lot of movement for the police to learn about mental health. A lot of education and
de-escalation.
right are being done to train the police, to teach them about the mental health, so they are educated. They would rather send the patient to the ER versus to jail, because there's nothing, there's nothing in jail to help these patients. So we are going to get the patient at the ER if you send them to, if you get the police to get them. So do not keep them in the house. Do not uh, s- s- uh, keep them at home thinking that you are doing them a favor. Don't Do not hesitate to call 911 thinking that 911 mean they're going to jail automatically, regardless what they've done, either break in the house, beat up someone, or anything like this, because all of that is what we call reaction from their dysregulation. So when they dysregulate, the brain is not acting well. This is not your baby acting out, it's the disease acting out. So everyone will understand that, everyone will forgive them for what they do. We then will treat the disease, we'll get rid of the disease and stabilize them. Then you'll have your baby back in a much more regulated mode. Then you everything's gonna be fine. But keeping them in the house, not calling 911, not calling for help, not reaching out for support, is a recipe for disaster. So please, 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 please get them help.
Mhm. It's very important, but I do understand the fear, in terms of what Um, but
Especially if you don't even have a, if some of them have no paper here, so I can get it and I can
yes,
copy everything. But one is not related to the other, so that's why you have to understand. Calling for help, even if you don't have insurance or anything, the kid will
I
get help, and we're not gonna call
yes,
immigration on that kid. So please bring the kids for help. That's important.
oui, parce qu'actuellement dans l'hôpital là, les moun yo te kon vini sans papier, nous pas jam rele aucun moun pou yo. Si yo pa gen papier, si yo pa gen papier, le pou nou voyo ale, nou voyo la kay bay fami yo. Sinon, si yo pa gen aucun kote pou yo ale, nou ese ede yo pou nou wè ki jan nou te
Correct.
kapab yo retounen nan kominote ya.
Correct.
Mais, yo bagay pou nou mentionner tout, chaque étape a même. M'habite New Jersey ou même moi habite Massachusetts. So, chaque état gen loi pa yo. Tout.
In Massachusetts, we are very we are very immigrant friendly. So, but as a matter of fact, when you come to the hospital, we treat you as a first class citizen. So it's different. Massachusetts is very friendly. I would say that this is probably one of the best state to live in when you don't have a green card or anything like this, because you will get the treatment. We'll find you the medication that you can buy at a low cost. Then we also will link you with the organization that would give you services for free, housing for free, things for free that you can continue to stay in treatment. So Massachusetts is probably one of the best in that category. So
Yes, and it's similar in New Jersey as well. Because nous kon gen moun soti New York tout l'autre côté pou yo vin dans l'hôpital yo New Jersey yo jwen aide. So, nan son sa, parce que m devle mentionner ça tout, parce que moun yo gen lot problem ki an dehors de ça, so nou pa ka ignorer ça tout.
definitively.
So, en termes de... So, tu as parlé de famille, non? Famille haïtienne. So, en termes... famille, non, li ka yon protective factor, mais famille, non, tout ka yon risk factor. Right?
Correct. And I mentioned it. It's like you have that some of the family member who think that you who treat you like you're weak if you're talking about mental health. You're not you're not a strong person. You and they're ready to even disown you if you're talking about mental health in front of them. It was even interesting myself as my upbringing. My parents divorced when I was in my teenage year, and at that time, my aunt was a psych nurse practitioner at that time, and I reached out to her, and at that time, she told me, "Get over it. You'll be fine." Um, and I
Mm-hmm.
know I wasn't fine. But again, living in Haiti, you have no other choice than being in a survival mode, and then you learn how to deal with it. And I think the sun in Haiti does so much too for your brain. It heals you in a way that's a different with all to itself. But I think that family dynamic sometimes, and that's why I myself I just don't want to be in that same category at that generation past. I just want to continue to tell people that it's not okay to just get over it. It's not okay to just poo poo it. It's not okay to just say you're gonna be okay, because you need you need to take care of it the right way. If
Mm-hmm.
you have diabetes, I'm not gonna say oh, you're gonna be okay. I'm gonna tell you to eat well. I'm gonna tell you to do exercise. I'm gonna tell you to eat proper regimen and follow doctor's appointment so you can maintain,
Yep.
uh, do well. So I'll do the same for mental health. If you had a bleeding arm, I'm not gonna say, "Oh, you're gonna be okay." I'm gonna put pressure on it. I'm gonna make sure that I stop the bleeding, and
Mhm.
and do a proper dressing and bandage for you, so you won't continue to bleed. So why would I see you suffering with mental health and for me to just walk away and said you're gonna be okay? Oh, you're gonna be okay. No, I am not going to do it because I'm gonna respect that mental health is a true illness and it needs to be taken care of.
Um, but I think in terms of listen protective, because the actually high identification, ethnic identification, is a major protective factor. Like, the fact that nous connecter à Haïti, nous connaît les ancêtres, nous, tout ça, um, que yo te fait côté nous camper dans l'histoire. Um, ça aide nous en termes de santé mentale, aider c'est ça ma jeune fille tout. Um, pour yo connexion ça. Mais en même temps, tout, en tant qu'un peuple, nous avons un pile trauma. Nous pas qu'à nous pas qu'à nier ça. Nous avons un pile trauma. Nous avons nous élevé petit. Dans ces bagages que nous dit, que nous fait, nous créer trauma.
Correct. But I think, and I'm glad. Although I was scared at first, you remember how much how scared I was when you reach out to me because I it, we 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 as a society, we as a community have not done so much, have not done too many things that we can be proud of. So I'm worried about it. So at times it's hard to to link ourselves with this community because we've we've we are so behind. This is probably the word to say. It's like we went from going to be the top of the black uh community, the pearl, the best, and this and that, and then after that we going down. We went so deep in the hole, and now we just like barely can maintain. But at the same time, when you see the Papa Cold scares all and so forth, I'm trying to see how uh, I can reach out to again the professionals like you did, to see if we can recreate something that we can be proud, some things that can do less traumatic, like you just saying, to the community, because many of other folks like the Asian, the Spanish, everybody they have something that they can hold on to
Mhm.
actively to say this is what we're doing, this is where we can go, this is where can we reach out, but we don't. And I'm glad you're doing something spectacular with the NAP, and I'll continue to support that and continue to keep the words out and have people participate in this. I think this is amazing what you do, what you guys are putting together there. And me on my side, I'm working with a lot of other um, Haitian business partner to do a lot of work. We are working on other business model to see if we can create retirement home in DR. We're trying to. I'm flying. I'm going to where Canada next week to see if we can uh, to see what we how we can expose the business there. I'm trying to go probably to Puerto Rico to see how we can move the business there because we have a lot of partner that's trying to join that model. Because the reason I went business first is because we don't want to sit in that realm of waiting for someone to give us money. We most of our partners, we have the money, so we just want to do it and then continue to create that, so we can have a platform where we said, oh, we are Haitian professionals, and we also can create something that we can be proud of. So the Haitian don't feel so much down that we all doing the wrong things all the time, and we all killing our president all the time. We all killing and kidnapping our people all the time. But so that's understandable. But we hope 5 years from now, 3 years from now, a year from now, when we talk, we'll be in a better platform because we can have much more organization like the NAP, like mine, like other organization that can talk more, or we can have even a unified organization that can speak volume of multiple things that we do together. Because I think one of the key things that I accentuate more with my organization is how can we unite most of the positive organization that we do. How can we ally them together so we can have a huge organization where Haitian feels they can be proud of and say, oh, this is something that we're doing in the community that we can be proud together, that we can be proud of together as a nation.
And that community involvement and togetherness is very important in terms of protective factors, because I mean, when you look at the research, and even for me, my own experience, you
Yes,
know, even in income, if you look at it, even if you have high income, when you have that community support, you're less likely to experience those mental health um, issues that I mentioned before, where
yes,
especially if you in a community where you are the only minority, quote unquote, you
yes,
know. So that community support is major in terms of protective factors for adolescents.
yes, 100%. Yes,
One thing I wanted us to talk too about a little bit more is in terms of a resource for families and who are experiencing who have a child who, because we mentioned what that might look like for them, also, but then what do they do?
right.
What do they do? How do they talk to them? Because you know, an pil fwa, wale wale di pa an, oh, mgen panse pou m fè tèt mwen mal, pa e sa yo. An pil fwa, paran yo ka pa kon sa pou yo fè, pa selman ki yo pa kon sa pou yo fè, men jan yo pran situasyon tou. Li kon vreman ekstrem, selon sa m tande nan men, an pil nan men ti moun yo ke mwen yo.
Correct.
Um, so nan san sa, ki jan pou nou pala ave ti moun sa, si ti moun ta vin kote ou di yo kon sa, ke yo anvi fè tèt yo mal, yo deprime ou kwa kon sa ka pas ave yo.
I think personally myself, I would say bottom line, if for anything, if for anything, I'm gonna say it so loud, if for anything you don't know what where to go, what to do, really your community l'hôpital ou mande qui ça pour faire. That's probably number one. Or call um suicidal helpline at 800 number 273 8255 or 800 273 talk. They'll guide you. Ou bien 911. What number? 911. They will stay with you on that call. They will guide you. They will support you. They will find you someone who speak Creole. They will help you. Then they will get someone in the community who speak Creole. They will guide you. If for anything. From
Mm-hmm.
that point forward, I think there is no way you're gonna feel alone because they will find you community resources, clinician resources, people in the community that can give you some visit, that can pull that kid out of the house if possible. That's the major key. Then everything else, because my thing is, it's like, if it's a preliminary crisis where you suspicious, you are suspecting something going on, you can start talking in the church. You can start talking at work. You can start finding people who know and find out what's going on. But if not, if things are imminent because the kid is really becoming aggressive, the kid is really is going down the hole, you feel like he's high as a kite in the house and you can't even have a conversation with him, that he's talking about, you find him with knives cutting himself and he's bleeding and you don't know really what to do. 911 is your best friend, because you know, first he's gonna be alive, second he's gonna, then from there you can get the help that you need because they're gonna connect you with the right resources and right connection. So I would say, because unfortunately what happened, I can give you NAMI to connect you with your family with mental health. I can give you so many resources there is. All of that can be good and they will give it to you at the hospital. But if that kid is in distress and is about to kill himself, or he's hanging himself in the basement, he's doing something to hurt himself, or none of them is going to save you. 911 is your best friend. So do not hesitate. I'm going to tell you how one of my best friend is probably not with us now today. Because of the culture, he called his mom. They were living in a two-story house. He took the pill, a bottle of pills on the second floor. He collapsed in in his mom's arm. The mom, instead of calling 911, asked to call the big brother who lives in the first floor. You imagine now the time that's ticking, because the kid collapsed. The brain is going down, and you have a certain amount of time that you have to get to revive in order to save the brain. He's gone. Nobody's calling 911 because they're waiting for the big brother to will, because they don't know any better. So by the time the brother come to revive the kid, what do you think happened? The brain is not savable.
Yeah.
So I don't want people to call the brother, the sister, the mother, the auntie, the uncle. Do not. And I remember even myself, I got a call one time. It was my sister who called me for my nephew. I said, do not hang up fast. Call 911, because the solution, even though me with my experience, I cannot do anything for you 30 miles away, 40 miles away, 50 miles away. But 911 is your best friend, because they can be there in 5 minutes, 15 minutes. They're going to save you. They're going to save your life. They're going to save your kid's life. I cannot save it. I cannot do anything for you. So remember, the key today to save your kid is 911
In a major crisis.
in the major crisis. Yes. And then
Um, I'm sorry, go ahead.
go ahead. Then they'll connect you and then go there with that major idea that I want to know everything before I leave that hospital. Give me every single resources. Connect me. Stay connected. I want everything, every help that I can get in the community to know what I need. Connection, learning experience for myself, for that kid, for every people in that family, every single person in that family. I want every help that I can get so we all can be aware of what going on from this point forward, how we can help this kid moving forward.
One thing that I wanted to add as well. So 988 988 988 is the new number for the suicide hotline. So they've changed it to make it similar, I guess, to 911 instead of having to dial that whole number for the
Was
so
that a new law? I think that was just
I
happened
think yes, in
in
July,
July.
it
I think,
became
yeah.
active. So then you'll be able to talk to somebody if you somebody is experiencing suicidal thoughts or whatnot. They can connect you to a counselor live and so forth and link you to support and services.
But in case you forget the 988, instead of doing it wrong, do 911. They'll connect you to 988. I swear, I'm
They
telling
can
you.
do that too. They
Because
the
when you're in panic mode, you're gonna do 889 988. You're gonna do so many different numbers, but
yeah,
911 you won't forget it.
yeah, the dispatchers will. So I wanted to open it up a little bit to the audience for potential questions that they might have. Um, for us, I guess it's already up there.
Yeah.
How do you approach that Haitian relative that think it's just l'église? I mean, les l'église, l'école, la caille, but seeing the clear depression the child has.
Uh, but that's fine. But I,
Mm-hmm.
I think l'église, l'école lacade is not a bad thing. Is not a bad thing. Luckily, right now, like I said, my most of my talk is gonna be in l'église, so we are moving towards helping and educate the community. We're gonna do this. We're gonna bring the service now to the churches to bring awareness to the community. Most schools have guardian counselor that would um, bring some counseling for the students, so that's fine. So they can get the counseling in school and learn about their mental illness and they learn about themselves, learn about their trauma, learn about how to deal with their trauma. So I'm still fine with that. I don't think any of that would prevent them from being themselves and from learning about themselves and uh, um, from healing themselves if they have an illness and they need help with that illness. I think uh, uh,
Unless the trauma or the issues happening in one of those settings, then that can be problematic in itself.
correct,
But I don't know in what context
correct.
your audience member mentioned that. But so those are in terms of that. Those are basic needs, I guess, in terms of Haitian community. L'église, l'école, la caille. That's it. But there's more to you as a child, as a person, as a being. So maybe from that context, to acknowledge the whole you, who you are as an individual, outside of just you are the
Right,
child and I'm the parent, and then because all of these things can be protective factors, but they also too can be
right. If
concerning.
they using it is if they create the leglise and l'école lacaille as you have to do this as a traumatic event, then it's a problem. Because I know some of them is like if you don't go to leglise, I'm gonna beat you up because you must go to the this done all of that to me it's traumatic and we need to do more to have a dialogue and conversation with our uh, kids versus rally since you on but I'm gonna bat you super l'église, I'm gonna bat you super l'école, I'm gonna bat you. It's all relative, but like you said, depends on what context this has been um, asked.
Hmm. Yeah, so I mean, if maybe the person can add more to the question, but it is um but both you can go either way. It can be protective factors, and it can also be risk factors depending on the dynamics and what's happening in those environment. But part of it is just to find a source of I guess to assist if there's issues going on. But then if it's just okay, this is what you're supposed to do. That's all you do, and then the child may have other ideas for regarding what they want to do or, or how they want to live their life. Because realistically, a Haitian child being raised in America, you're being raised in a bicultural dynamic, whereas the parent is from the home country, but but technically you're not, because you're being raised here in this context. So that requires something different than if you were being raised in Haiti. So there's just more that goes onto it, and
Correct.
oftentimes the parents like just hold on to the parenting from the whole home country, which there are a lot of positive things about um, um, Haitian culture, and then also, but also you have to be mindful that your child being raised here too, so you kind of have to understand the dynamic of this culture and to kind
Correct.
of blend them in a way to meet the child's need.
Yes.
So, um, yeah. Now, I think the second question: what would you say to the young Haitian adult can look back objectively and know their traditional upbringing has led to some trauma? I think we talked about this a little bit,
Right.
right? So, uh,
But
a
that's
lot
exactly why I said I think we do not minimize the need to always provide or engage your kids in some treatment and therapy, because um, some of the trauma that the upbringing has led to your kid, sometimes it could have been prevented, sometimes it could have not been prevented, because uh, misère, our culture, the craziness that's going on in Haiti, all of those things may not be made just because we are Haitian, and it may not be the fault of either parent. So it happened because of where we came from and so
the
forth,
situation, yeah.
the situation. So therefore, it's important to understand um, finding true uh, therapy, finding someone for that kid to talk to and to share those concern and those things that's going on through their mind is not a bad thing. Is not a bad thing. I had recommended therapy for some of Haitian youth and family. These kids have grown from, it's almost like a change of life from the time I've known them, from the time I've seen them now. Oh my God! It's like it's day, the light to day, the difference, because they bright now, they open, they do well in school, it's amazing. So I would say keep them in therapy, keep them in treatment, allow them to express those feelings, because those feelings, as they build up inside of them, can cause damage, and you don't want that to happen. So keep them in treatment, keep them in therapy, and that's probably the best solution and the best advice I could give.
Yeah, and also to validate their feelings and their experiences, because realistically, looking back, all of us, we've had probably collectively we share trauma, and
Correct.
individually we do too. So
Yes.
I think all of us, there's not one Haitian person that I've worked with who cannot And sometimes we don't even think of it as trauma because it's so ingrained and it's so
Correct.
conditioned that we just go on. We keep on moving, like you mentioned in
Correct.
the beginning.
Right.
Um, but when you stop and really look at it, it is.
Right.
And so yeah, validate their experience and then also encourage them to reach out for help in order to process some of these things, because then sometimes there's a duality. You love your parents, you love whatever, but some of the um methods, I guess you could say, that they've used is questionable. and it does leave a mark. And so both can exist, that where you love them and you thankful to them, but can acknowledge they stuff did happen, you know?
Right. Right. So true.
Mhm. Um, okay, so this one is a little bit longer. So there have been stories of a child having a mental health crisis. The responding police officers don't always know how to handle the situation. How can we address this in a safe manner?
But I think this is a nationwide crisis. The work is being done as we speak. It's been in every single corner of this country now. Everybody's talking about it. Everybody's mentioning it. So the world is on alert. A lot of police officers are being trained on how to work with folks with mental health um, conditions. So um, we are. This is a journey. It's going to be better. I would not say because of past experience to hesitate and not to refrain yourself from looking and seeking for help. Um, I would say continue to look for help and seek for help, but be vigilant. If by bad luck you get an officer that's still having um, bad method or utilizing bad method to teach your uh, kids or your loved one the wrong way, speak up and record what's going on and bring that to their supervisors. But it's been, as you can see, a nationwide awareness that they need to um, treat our patient as patient. They need to work with our patient, with our um, patient the way they supposed to. And again, for any condition, if they are doing the wrong thing, they need to face the condition and pay for it. And so we need to do the right thing, call them for help, and if they do the wrong thing, call them on it. And if they're not doing it right, they need to change their way and do it right. And if they do it right, and then that's that's the right thing. But I would not keep the fear of them not doing their job. It's almost like the fact that some nurses or from doctors are not doing the right thing. I'm not going to the hospital. No, I'm going to the hospital because I know 99% of the time the nurses and the doctors will do the right thing. So if I have a nurse ratchet or the doctor insane who's doing the wrong thing, I'm gonna call him on it. I'm gonna call her on it, and to do the right thing. If they hopefully they do the right thing. If they don't, we call the board on them that this is the right thing to do. So call if your child is in danger, you call for help, and hopefully the help is given the right way. If it's not, you call whomever on it, whomever is doing the wrong thing on it, so they can do the right thing. I'm an advocate for patient, advocate for the right thing to happen. So I'm that not gonna prevent me from speak up. I used to be, I remember when I was the power of attorney for my mother, I used to tell doctors to get out my face if you're telling me the wrong thing about my mother. You need to tell me, you need to, you need to know what you're doing when you come in and speak with me about my mother. If you don't, get out my face, give me someone else. So you still have to be vigilant about your kids, be vigilant about your loved one, and be their advocate when they can't. But that would not prevent you or stop you from going to the hospital and reach out for help, because that's where help is.
I do agree. Um, so I can understand what the audience member is saying because I have seen a lot working in the hospitals. However, that is not a reason not to reach out for help, like Cole said.
Uh,
But you follow up. My patient
Right.
used to sweep him after, you know? Um, so I mean, yes, that's added stuff that you should not have to do, but at the same time, you have to speak up for yourself and address the issues as they come. First, you deal with the crisis, and then afterwards, you follow up.
Yes.
Um,
And
instead of quiet.
yeah, the problem is everywhere. You can be the best hospital in the world and still have leftover people who are doing things the wrong way. I still sometimes have to wake up some of my staff and tell them, what are you doing? You got what? Excuse me? No, you don't do this. You don't do that. You don't do this. You don't do that. So that's a daily thing that I do every day. Because you're the best, that doesn't mean people are still not doing things the wrong way at times. So, but you still stay on your toes to remind people why are we here and what we need to do to take care of our patient the right way, and to make sure the patient get the best help every day. I do a lot of consultation for emergency department, because you know how now it's a very um, that's the new uh, trend where they are trying to get psych mental health in emergency rooms. So most of the major emergency rooms are creating a psych emergency room within the emergency room. So I do a lot of consultation nationwide for that. So you'll be amazed what you hear from those medical nurses or medical folks within that emergency room, because they have, for them, saving lives and psych people, they don't can understand the emotion, the being a crisis, the emotion being something serious. So you got to wake them up and say, yes, it is serious, because if that emotion is dysregulated, it's going to cause death anyway. So you got to pay attention to it, because if you don't, it's going to cause death. So the effect of it will cause death. So you got to pay attention to it. So I had to wake them up all the time and said, pay attention, pay attention. Hello, hello. It may not, they may not be bleeding and losing breath and all of that. However, if we don't pay attention to them, they're gonna go halfway to their house to kill themselves. So it's gonna still the same death. So you got to pay attention. So it's a lot of work to be done. It's not the perfect science yet. We're working on it, and we're working very hard on it. Trust me. On the background, we do a lot of work, but you got to trust the system, because that's what we have. And with the team that I work with, we do a lot of work every day to make sure that the mental health system is respected, and the your patient, your loved ones are being respected on a daily basis. So that I can reassure that, and we're never gonna sleep until we see that happening moving forward.
Well, before we wrap up, I wanted to take a moment to thank organizers for hosting us, and then also our partners, Chocorilla, Bouquet Right Accountancy, College Cafe Consulting, and Financial Education. Also, I wanted to ask the public, since this is going to be an ongoing series, if they can let us know what other topics they would like for us to discuss, because there's a lot in the Haitian community relating to mental health. So if you could please let me know what other topics are you would be interested in us discussing. Um, so any final thoughts, Coles? Thank you so much for coming and uh,
No, thank you.
dialoguing, I guess you could say. Bushita fonti koze su sujet
No,
sa.
no, no. Thank you so much for inviting me. I think we so embedded in our life, our daily life, working, studying, doing so many things, and we forget that important part of it, to share that knowledge and to we do that awareness among that community that we love so much. So I thank you so much for inviting me. Thank you for allowing me to be part of this awareness convite, how would I say in our language. And like I said, you gave me a start point, and I will continue to do this, and partnering with the community, partnering with the churches, partnering with the schools, to voice that awareness throughout the nation, and hopefully we'll save some lives. Hopefully we'll create a better future for our community, um, and like I said, a year from now, 2 years from now, we'll be sitting uh, in a different tone, looking back and said, "Oh my God, what a great change that has happening, where everybody can be proud talking about mental health as an illness versus something taboo or something that's shameful to talk about."
Mhm. Yeah, but the reality is, if you're not santé physique, ou pa gen santé physique, sou pa gen santé mentale, right?
Correct, 100%, 100%.
So li vreman important pou nou adrese sa nan kominote Haitien, paske apil fwa moun yo pa pense an term de santé mentale la, santé mentale la ka afekte santé fizik la, me an
Yep,
realite li kapab, espesyalman nan ti moun yo, paske sa ka prezante an pil jan. Ti
right.
moun kompatman ka chanje, ou yon bagay pase, ou el pa menm jan, e an pil fwa nou pa menm pense ke, oh, mentalman ki yon bagay ka pase avek ti moun nan. So it's
Right.
very important for us to open up that dialogue, that conversation, to discuss these things. And so yes, so that's why we're hoping this ongoing conversation will bring more awareness and provide more resources for our community to be more open-minded about some of these things.
Awesome. Yes.
So, any final thoughts?
Um, Again, I want people to reach out if they need help, if they have any more questions. I think they have your number, they have my number. This is not about us. This is about a bigger mission. So I am available to help in anytime possible. If they have any questions, I'm here. I will reach out and I would respond to them anytime. So I'm open to that. I don't mind. So if they have any questions in the future and they want to reach out, I'm always open to answer them anytime.
Well, thank you. Thank you again. And thank you, the audience, for um, participating with us. And I'll see you for the next symposium. Have a good
Thank
rest
you.
of the day.
See you then. Take care. Thank you.